can confirm that the cumulative total number of cases in Victoria is now 10,931. That's 397 more than we reported yesterday. The breakdown of those cases is 37 that are linked to outbreaks and other complex cases, and 360 that are under investigation by our public health team. That is a very significant number of new cases, and whilst there's always a temptation to try and read trends into these numbers, there is a growing concern in relation to the number of community transmission cases within that data. I'll return to that in just a moment. In the meantime, can I indicate to you that there are now 116 people who have passed away as a result of this global pandemic. That is 3 further deaths since our last report. A man in his 80s, a woman in her 80s, and a woman in her 90s. We send our condolences, our best wishes, our support to each of those families. This will be an incredibly difficult time for them, and we hope there is some small measure of comfort knowing that we are with you and that we send our best wishes to you. In terms of total active cases, there are 5,919 of those. In terms of hospital patients, there are currently 379 patients in hospital and 41 patients that are in intensive care. 24 of those ICU patients are on ventilators. In terms of testing numbers, we have now conducted 1,633,953 tests. That's an increase of 25,501 since our last update. There are now 1,075 cases amongst health workers, and the total number of cases in aged care, active cases in aged care, is 1,008. If I can just speak a little bit to aged care, and then I want to talk about community transmission just for a short time, and then Lisa's going to take you through some compliance and enforcement issues, and of course Deputy Commissioner Nugent is here as well, and happy to take any questions you might have. The situation in aged care remains very serious, a very significant challenge, very confronting in many ways, and we know and understand that this is incredibly difficult for residents, very, very difficult for families as well. All governments, all agencies are working together as closely as we possibly can to have one focus, and that is on residents, their wellbeing, their health, and by extension, the wellbeing of families who are obviously concerned and very keen to get as much information as quickly as they possibly can. I can confirm for you that there's now been 570 shifts worked by hospital nurses across a number of private aged care settings. That is something that we should be very proud of, very, very proud and very grateful to those teams of nurses and other health workers who support them. These are confronting environments, these are very challenging environments, and as always, our nurses are stepping up and doing the most important work. To all those Victorians who are not following the rules, and it's by no means the majority, the vast majority of people are following the rules, and we're deeply grateful to you, but to those who are not, you need to just think for a moment. Nurses and doctors and ambulance paramedics and others in our health team, they're stepping up and playing their part, and it's up to you to step up and play yours. This will not end anytime soon if people don't follow those rules. And I don't want to detract from those who are. We're very grateful to them. And it's lots of different contributions in lots of different ways. But for those who are not doing the right thing, and Lisa I think will speak to some quite amazing examples of that sort of behaviour, all you're doing is contributing to the spread of the virus. And whether you want this to be over sooner, whether you want to avoid a fine, whether you want to protect your family and every family, or whether you honour the work that our healthcare workers do, our heroes do, then you've got to make much better choices than have been made in recent times. Just before I hand to Lisa on community transmission, can I indicate that of those active, this always lags a day behind because those cases that we're investigating, obviously it takes some time to investigate those. But we can, as a result of that effort, so that'll be from recent days, confirm that there's an additional 49 cases, mystery cases, 49 cases where we simply cannot track back what the index case is, what's the zero case, where did it start, where did those people get it from. Now the challenge with that, of course, is they are a mystery, and this is all about trying to know as much as you possibly can, as much intelligence and evidence and data as you possibly can. Those 49 cases and many more beyond that, if you look at the entirety of this pandemic, something like 1,841 cumulative community transmission cases since this began, so as a feature of the 10,931 I just read out, you can't be certain, of course, if there's that many that you don't know how they got it, you can't be certain that there isn't even further community transmission, even more mystery cases out there. That is, in some respects, our biggest challenge. No one wants to see large numbers reported in any context, but if you can track back where the origin of that was, then they're in a wholly different category to community transmission or mystery cases where you just can't work out how the person got it. That is a real concern, and that's what's driving some of the work that's being done. Was being done last night and today. Our public health officials engaging with some of their interstate colleagues, their national colleagues. It's a very significant group of experts that are working through those particular community transmission numbers and doing not just modelling, but looking in very fine detail at all of that data. Today is not the day to announce any further steps, but that work is under active. That is an active process. We are giving due consideration to a whole range of different options, and when I'm in a position to announce decisions that I've made, then of course I will do that, and we'll take any and all questions about that at that time. But I know 49 doesn't seem a very large number, but I'd just say to all Victorians that 49 where you can't be certain how they got it, that can mean there are many more than 49 out there that have very mild symptoms or no symptoms at all, can be at the height of their infectivity, and be infecting other people even unbeknownst to them. That's the real challenge here. It is a silent enemy. It is a very cunning enemy as well, but particularly those community transmission cases, they are of greatest concern to us, and that's why we find ourselves deep into a process to evaluate these things, and we can't rule out further steps being taken. They'll be taken because that's what's necessary. There'll be nothing else driving it. But when I'm in a position to make further announcements about that, then of course I will. Just before I do throw to Lisa, I do want to thank every single Victorian who, whilst not enjoying this experience in any way, whilst being frustrated, you are still doing the right thing. That is incredibly important. It is a point of pride. We are all in this together, and anybody who doesn't think that's accurate, well, that's not only the wrong judgment to make, it's not a very smart judgment to make. Because Victoria Police, of whom I am very proud and grateful for the work they're doing, are out there doing that compliance work. They are issuing fines. They don't take any joy in doing that. They'd much rather be out there on their regular patrols, not finding anybody doing the wrong thing. But we have seen many examples of people who are not abiding by the rules, and that simply is, no one's entitled to do that, because there isn't a cost simply for them. There is a cost for all of us. So, to those who are doing the right thing, we are deeply grateful, particularly to those in our health team who are working hundreds and hundreds of shifts in very, very challenging circumstances, whether that be stepping in to replace entire workforces in aged care homes, or working in COVID-specific wards and treating patients who are gravely ill in our hospital system, public and private. We are very grateful to them. If you value their work, if you honour the skills and care, courage and compassion that they have, then we've all got to do the right thing. They're playing their part, and we have to play ours, all of us. We are all in this together. Whether we like that fact or not, it is the reality that we confront, and it is the only way, it is the only attitude that will get us to the other side of this. Now, to speak about some of those enforcement matters, and again, I don't want this to in any way detract from the great work that so many Victorians are doing, but it's appropriate to call out really bad behaviour when you see it, and that's exactly the purpose of some of the details that Lisa will provide to you. But the other point about her commentary will be a really profound thank you to Victoria Police and others authorised officers and others who are doing a fantastic job. I don't have an ADF door knocking update for you. As soon as I can get you one of those, I will at a subsequent briefing, but there's a big team out there doing that door knocking, every single positive case being door knocked. We are still finding people that aren't home. They should be home. There are significant penalties, and we're having a look at whether there's any need to change any of those penalties. There are options available to us, whether it be the on-the-spot fine versus fining people through the courts. That's a much bigger fine, but there is a balance to be struck there, and we will find that balance. But I do want to be very clear. It is not acceptable. It is not acceptable to have this virus and be out and about, going about your normal business. That is simply not appropriate. That's very dangerous. It's fundamentally irresponsible, and it needs to stop. And that's why Victoria Police and the ADF and authorised officers from the Health Department are out there literally knocking on doors. It's the wrong choice, and it's not a very smart choice. You will get caught and you will get fined. I'll now ask Lisa to add to my comments, and then we're happy to take any questions you have.
Thank you, Premier, and good morning. I too just really want to start by saying the overwhelming majority of Victorians every day are doing the right thing, from wearing masks when they're required to, from not leaving home unless for those 4 reasons. People who are not trying to get into non-restricted areas, people in Geelong now who are not having visitors, and I want to thank them because it is the overwhelming majority of Victorians. However, we are still continuing to see appalling behaviour. Appalling behaviour that I know Victorians themselves are fed up with, and you see that every day, people making comments about that. I'm fed up with it. Victoria Police are fed up with it. Can I be really clear, just in case there's any doubt at all, that there is absolutely no reason or need to drive from Melbourne to Wodonga to have a Big Mac. And that's one of the fines that was issued yesterday. There's absolutely no reason or need to drive from Melbourne to Ballarat for fresh air. There's absolutely no reason to drive from Werribee out to Springvale to buy groceries. They're just 3 of the fines that we saw issued yesterday. And behaviour that is, again, you ask why would people think that that's okay? They either don't care. It can't be because people aren't aware of the rules. I think there's no question when Victoria Police pull people over, they're aware of the rules, but yet have made a decision to blatantly breach the Chief Health Officer's directives. And those people all received a fine yesterday, as did people who decided having an Airbnb party was okay, and they all get issued with the $1,652 fine, or the people who continue to operate and go to a brothel. So again, fines and behaviour that is appalling and unacceptable and does need to stop. We all have a role to play in this. Victoria Police, their PSOs, the ADF, working side by side, are out there doing what they need to do in order to stop the spread, work with Victorians, provide reassurance to Victorians, but to hold those people to account who are displaying blatant disregard for the directives that have been issued. Directives that are tough, I know, for many people, but the directives that most Victorians are abiding by, and that all those Victorians expect everyone to abide by those directives, or for Victoria Police to hold them to account. So we've now reached the point where Victoria Police have done over 200,000 checks. So that's the community checks, out and about in communities, making sure that we don't have mass gatherings, making sure people are at home, making sure that people are abiding by the 4 restrictions, making sure that people are wearing masks. So over 200,000 checks, a significant amount of work from Victoria Police. In terms of the road checks, they've now reached over 452,000 checks on our roads since the road stops were put into place. A significant amount of work, working side by side with the ADF. I know today out with Victoria Police we have about 247 ADF staff working side by side with police at those stop points, but also out in the community at key areas, whether it might be the tan or where we know we've got particular groups encouraging people to breach the directives, cycling groups, for example. So together ADF and Victoria Police are working side by side to make sure people are following the directives. We've also got our police on our train stations, at ferries. We've got our PSOs out in the community doing checks. We've got PSOs at train stations. So if you're thinking of using a whole, back roads, if you're thinking that you can get around these rules, find ways to get around the rules, Victoria Police will be there. They don't want to be doing this. They don't want to be fining people. That's not their role. That's not how they work. But they will do this because they know it's in the best interests of Victoria, Victorians and Victoria's health. And it's the best way we can get out of these lockdowns if we all abide by those rules. So I want to thank every member of Victoria Police, every PSO, every member of the ADF who are working with us. They are doing an extraordinary job, an incredible job, a job that no one imagined they would have to play. And in my view, they are playing such a role that it is about saving lives and protecting Victorians. And I want to thank each and every member. And the way you can thank Victoria Police members is do the right thing.
Good. I'm happy to take any questions you have.
Do you think JobKeeper payments should remain the same for Victorian businesses and
Well, the JobKeeper payments and job seeker arrangements have been extended until March, and I think that all Victorians, indeed all Australians, are very pleased with those announcements that the Commonwealth Government made. As for any additional support for Victoria, I'd always reserve the right to continue my very productive discussions with the PM about those sorts of arrangements. They're not matters for me to announce. They're not matters for me to be lobbying for publicly, I suppose. I've got a good relationship with the PM. We'll be talking later again today, and so talking again later today. And I think the Prime Minister knows, and they've structured, Josh Frydenberg and the Prime Minister have structured their payments and their support to match the hardship that's being experienced. There's hardship here, of course there is, but there's hardship in lots of other parts of the country as well. Whether we need to go to additional support, of course I'd always reserve the right to have those discussions with the PM, and I'd be very confident that I would get a good hearing.
Premier, can you clarify how many, if any, of those 3 deaths occurred in aged care?
Sorry, Jodie, yes, I should have. I believe all 3 of them are connected to aged care. However, let me wait until the Chief Health Officer's report, media release comes out later in the day, just to double confirm that. If I can, in the intervening period, if I can confirm that, I will.
Just another question.
Sure.
Tony from the AMA has asked for all services, bar supermarkets, pharmacies and doctors to close. Where do you stand on those things?
Well, we are considering a number of options. What we've got at the moment, numbers that are too high, community transmission or mystery cases that are growing. That is a real concern to us. I'm trying to be as frank as I can be. I don't have announcements to make today, but there is a lot of work going on because this is not an easy thing to do. If you take further steps, you've got to make sure you've thought it through properly, that the rules can function, that any changes to the rules will actually deliver the desired outcome. And that is in many respects a circuit breaker to try and pull this up. I have known Dr. Bartani for a long time. I absolutely respect him and the work that he does. But again, today's not the day for those announcements. We're doing a lot of work, and when we are in a position to have more to say about any changes, of course we will.
Premier, some of the options being canvassed is the closure of certain businesses or industries. Is there work happening behind the scenes at the moment to secure supply lines, for example, meat and food and that sort of thing?
Look, part of the consideration of any additional moves has to be all of those sorts of issues, so people can be confident that all of those things are being thought through. Again, the best thing to do is to, if I can respectfully ask, we will do that work, and then when we're in a position to indicate the decisions that I've taken, the actions that we're going to take, then I'll be in a position then to brief you up on that. But you can rest assured, as can your readers and viewers and the rest of Victoria, can be absolutely confident that we're thinking through all of those issues. That does take a little bit of time. It's not a tap that you can just turn on or off, and they're not decisions that would ever be taken lightly, because there will be significant costs associated with even minor changes to the rules. Do come with a significant cost, but numbers are too high, and there is a growing case for us to do more. We will, in that what we may be doing now may not be enough when you consider it's brought the stability. It's not like these, as Brett indicated yesterday, these settings, as challenging as they are, have avoided the notion of thousands and thousands of cases each day in our health system being overwhelmed. That shouldn't be read to think that anyone's doing it easy in our hospital system. It's tough. It's very tough. Aged care particularly is very, very challenging. But we can't open up again at these sorts of levels, and therefore there's very detailed work being done about what possible next steps might look like.
What is that data that you're considering?
It's particularly not just case numbers, but a really granular breakdown of where those cases are coming from, what the common features of chains of transmission are, how many cases we can essentially wrap our arms around and deal with, and if you like, put those spot fires out versus those that we simply can't find the index case. That community transmission number, again, people, in the scheme of things, as we stand here every day, 49 doesn't necessarily seem a large number, but 49 mysteries, when it could be much more than that because you can't find who that original case was, that is a very significant concern to us.
Premier, can you number of GPs this morning who have patients that have tested positive who still haven't heard from the contact tracing team for more than 36 hours? These are vulnerable patients who don't have family who require supplies. Do you still think there are enough people in that contact tracing team? And are you still thinking that the timeline is 24 hours of a day to get back to these?
That's certainly the advice that I've got. I'm happy to follow that up for you. If there's specific examples, we can do that offline so as to protect the privacy of any of those people. In terms of contact tracing, it's an enormous team. They're all working very hard, but I think we all have to acknowledge that when you're talking about cohorts, groups as big as this, it is going to push any system. It is much bigger than it's ever been. It grows by the day in different ways, but it's a massive challenge. And for instance, again, not for the apportionment of blame or anything like that, but we do find it hard to get through to everybody. There are some people who, for one reason or another, are not answering the phone. They're not in a position to be able to participate in that long form interview, which gives us all the kind of treasure for us to then go and trace all the people that they've spent time with. That's why we've moved to the situation where the ADF and an authorised officer from the health department goes out and visits those people. And again, just to be clear on the context of that, yes, they're finding some people that aren't there. That's a great concern. They're also finding people who perhaps need a little bit more information, and they're able to provide that to them. And then there are other people who need a script filled or they need groceries. So it's not just about compliance, as important as that is. It's also about reaching out and saying, what can we do for you? What support do you need? Because getting everyone through this, that obviously leads to much, much better outcomes. On turnaround times, and I'm more than happy to try and chase that up.
Premier, can you confirm that Annalise Van Diemen has been moved on from the role of Deputy Cho, and does that show that there's discord or discord within the team?
No, I wouldn't say that at all. This is a united team and a team that's focused on the biggest challenge that any of us have ever faced. Dr. Van Diemen is a very eminent person and someone who's got skills and abilities that have been well proven during this crisis. But there are other functions. You see the avian flu issue that's being dealt with today. There are other public health and infectious diseases challenges beyond this. I know it's quite difficult to think beyond this particular crisis, but we have to have systems and processes in place that do just that. Otherwise, things wouldn't get the appropriate response.
Is that overhaul, which is beyond just Dr. Van Diemen, is that an indication that things as they are haven't been working?
No, I think what it is a clear indication that this challenge, this task grows by the day, and it's very important that we have the best arrangements in place. So you've got to always be flexible, and if you need to make a change or to add to a framework or to step things up even further, that's not a commentary on what you were doing. It's simply, I think it speaks to a preparedness to make those changes and to enhance, improve, to modify wherever you think that's going to get you the best yield. And that's exactly what we've announced. It's exactly what we've done. I suppose one of the biggest differences would be that I think we've been really clear with everybody about that. But that's not the only change. There's been lots of changes all the way through this. As it's a dynamic problem, a wildly infectious dynamic problem. Therefore, you can't have a static response to it.
Can I ask Minister Neville a question?
You certainly can.
At the moment, as we
if officers approach somebody who isn't wearing a face covering and they say, oh, I've got medical dispensation, is there much that officers can do in the way of enforcing those rules? And are you considering any greater powers for officers to enforce those rules?
Look, I will get Rick to talk to this because if that's okay, Jodie, he's the one who's on the ground dealing with officers. But I'd just say that, Victoria Police en masse have shown a great deal of discretion. They handed out masks. They only gave people fines who were blatantly not doing it. I think we're at somewhere like 270 fines now for masks, so that they are issuing fines. And I'm not sure that there are any barriers to them doing that, but let's Rick go through that.
Thanks, Minister. So with respect to the masks, certainly that is a reason that a person doesn't need to wear a mask if they have a medical illness. For our own members, what we're finding when they're talking to people around that have that, they are clearly able to demonstrate that they have legitimately got an exemption to wearing the mask. So they've got Ventolin sprays, they've got doctors' material, information, communications, or whatever that support that. So we're not seeing that as a problem at this stage.
How are officers generally feeling about enforcing these rules? They do a tough job as it is. How are they going?
They're going really well. The police members themselves are doing an outstanding job. They're out there on the vehicle checkpoints 24 hours a day. So 2 o'clock in the morning, it's freezing cold. They're still bringing in the traffic. They're still talking to the people. They understand the need for this. They understand that we need to have an enforcement approach because there are some people that are just blatantly selfish. What we're seeing is too many individuals who are going about their lives as though this pandemic doesn't exist. That's what we're seeing. And so those people are travelling, as the Minister said, for reasons that they shouldn't be. We had someone go from Bentley up to Sunbury to get some takeaway. Now, why? There's absolutely no need. And it's because they're selfish. And they're just carrying on, as I said, carrying on with their lives as though this pandemic doesn't exist. So the members are doing an outstanding job. As has been mentioned, I think, by the Premier, we don't want to be giving out fines. Not for these sorts of things. There's a whole lot of other activities we'd prefer to be doing, engaging with the community, working with the community to keep them safe. So, the sooner we don't have to, the better. And that will be achieved by people who actually decide to abide by the directions. And the sooner we do that, the sooner we'll limit the spread and the sooner we can get past this.
There have been a number of instances with COVID deniers, you could call them, where they've filmed officers and confronted them. Are you proud of the way that Victoria Police officers have conducted themselves in those situations?
Absolutely, they've done a great job. But I'm also proud of the community because the community is helping self-regulate this behaviour. It's actually saying, you know what, you're 5 minutes of fame on social media for that. So I think for both our members, I'm enormously proud, but also the way in which the community has responded to it as well.
Sure.
Just on aged care.
Yes.
So one of obviously the many mistakes, particularly 2000 at Epic Gardens, was that there was a delay in sending testing teams in, and then there was a delay of up to 4 days getting the test results back. That's specific to Epic Gardens.
Yeah.
The problem that's been
Well, look, that's not the advice that I have. And can I just say that I know people who may have responsibility for some of these facilities are hurting, and there's not much to be gained by trying to apportion blame. What's important here is that we focus on the thing that should always be at the centre of our attention and the centre of our focus, and that is the health and safety and well-being of residents. And that is what I'm exclusively focused on. It's what the Prime Minister is exclusively focused on. We have moved literally hundreds and hundreds of residents into hospitals. We are covering, as I said before, 570 shifts, and I know that mightn't seem a lot, but that is an enormous amount of work that would otherwise go on in our public and private hospitals. That is now entire workforces being replaced because safety and well-being of residents has to be at the centre of this. I can understand that people are hurting, but they're not hurting anywhere near as much as what the families of people who've died are hurting. Let's be where we should be on this, and that is 100% exclusively focused on providing the best care to those who need it. That's the approach I take. It's the approach the Prime Minister takes, and I think it's the only way for us to go.
Well, Premier, what is the information that you have? Because there's the outbreak began on July 9. The Commonwealth has said that they weren't notified until July 14. What is the information that you have? Why is that?
The information I have in relation to a number of these outbreaks. The information I have in relation to these outbreaks is that public health teams have been in there as quickly as possible. The notion of long delays, that's not what I'm briefed at all. The key point here is there have been a number of practices. There's been a number of issues. This is not the forum. In the midst of this, this is not the time for us to be going through those things. I don't want anything I say today to be seen as having a broader debate about what the best way of providing aged care is. I don't think that benefits anybody. There are other processes that are going on, but my advice and my position is that our public health team, our nurses, everyone involved have done everything they need to do, and they've done it with a sense of urgency, and that's the most important thing. For instance, I think people need to just reflect on the fact that we've had, first of all, it was that we shouldn't have sent all the staff home. Now apparently we didn't send them home fast enough. I think we just need to remember that these are very challenging environments, and the thing to do right now is to focus on the residents and making sure that they're getting the care that they need. That's exactly what's happening, and I really don't think we have the luxury of any of this other stuff. We need to get on and make sure that we provide the very best care.
So are you saying that the Commonwealth were immediately notified of that outbreak, and why shouldn't we be analysing mistakes?
No, I'm not criticising you for analysing anything.
And fix any mistakes if there are there. Why shouldn't that be?
Well, I'm not suggesting. Hang on a minute. There's been some claims made, and what I'm saying to you is that my advice is completely different. And rather than trying to apportion blame on these things, we should be focused on providing care and support to these residents. Now, whilst I might like to avoid any criticism of me to run into a very long list of issues in aged care, I'm not going to do that, because I don't think that is helpful. I don't think that is the best thing to do. The challenge here is to step in and provide care and support to extremely vulnerable people. We are assuming that role. And I'm very grateful to every one of those nurses and other support staff who are doing it. My advice is very different to what you've put to me. I'm more than happy to have the public health team follow up on that. I'm not being in any way critical of you asking the questions. I'm simply saying, being clear with you, or trying to be clear with you about where my focus is and where I think all of our focus should be, certainly in terms of those of us who've got a responsibility to care for these residents. Not every day, but in the midst of this crisis, we've assumed that role, and we need to get on and get that done. If there's any further information I can give you about any of those specific claims, I'm happy to do that. There's no discord, there's no argument, there's no dispute here. The only argument that the Prime Minister and I are engaged in, the only fight that the Prime Minister and I are engaged in, is a fight against this virus. And it presents in deadly terms in aged care, and we're not worried about who runs aged care. We're just worried about those residents, their families, and getting this job done.
Some of those residents' families are still struggling to find out where their loved ones
Yes.
are. They're calling that number and no one's answering. What's your message to them? What should they be doing?
I've raised this matter with the PM, and he was actioning this. I haven't got an update today. I think that was yesterday or the night before, actually, I raised this issue, and I know that they're working hard to try and have better call centre arrangements. We know that there are some cultural and language issues that at play there. Not all of it, but that is a driver of some of that challenge. We want to make sure that families get the best information as quickly as they possibly can. The Prime Minister is working on that. To the extent that we can support that, we will. In fact, what we've got happening at the moment is nurses who work for us taking iPads, taking phones to people to try and connect them. That's a challenging thing to do. They've got lots of other work to do, but everyone's doing their very best, and I think that's better today than it was. It's by no means good enough yet, but we'll all keep working hard to make sure that we can get people the clarity that they are fundamentally entitled to. What's the status of their loved one? Can they speak to them? That's that sense of reassurance, and dealing with some of the some of the obvious anguish, that's a real priority.
I mean, the iPads thing is obviously very lovely, but surely there's a simple way for people to find out what hospital their loved ones are. That's a very
Yep, and what I'm saying to you is that's a matter that the Commonwealth are working very hard on, and if we can support them in that work, of course we will, and indeed we are. Nurses are not there to do essentially clerical work, but we all know nurses. We all know what they do. They step up and they get the job done, and they are supporting families not just with the clinical care of a loved one, but they're going even further than that. I know that this has been highlighted as an issue, and I know that federal ministers are working hard on this, and if we can help, we absolutely will.
Do you now accept that a lot of areas of Victoria's public health teams are under-resourced, not enough staff, that kind of thing?
No, there's 2,000 of them at the moment, working very hard with nearly $2 billion worth of support. Is the team bigger than it's ever been? Yes, because this is a 1 in 100 year event. I think I went to this the other day. The notion that if we'd had, a handful more staff a year ago, well, we'd be in a different position. That'd be terrific if that was the case. I just don't think that logic holds up. Every public health team in our nation, in every capital, in every part of our nation, is bigger today than it has ever been, because this is a 1 in 100 year event, and they're all working extremely hard. Will it need to get bigger still? I think that it may, and that's why the constant offer is of more support, more resources, more systems and processes, all of that. Every single day we examine whether there's more that we can do, and that's why we've seen a really strong partnership between government agencies across the Victorian public service, many people working in public health that would never have thought that their skills would be relevant to a public health challenge, but of course they are. For instance, having more than 100 Ambulance Victoria paramedics on the phones, doing interviews, conducting that contact tracing work, all the way through to call centre staff from travel agencies who've been stood down, coming and working for us. They've been working for us for months. You've always got a surge when you've got a massive challenge. That's what we face now, and that's exactly what we've done. And if we have to continue to do that, I think we will, then of course we will.
Last question, please.
This is just asking for them to fix testing activities. Some of them paid their own and found that a third of masks Is that actually the approach to that?
No, I've not been briefed on that, but I'm more than happy to follow up with the public health team, or more likely the Chief Medical Officer in Victoria rather than the Chief Health Officer, Andrew Wilson, but I'm more than happy to chase that up. Safer Care Victoria do a lot of that work. We've had, for instance, I've had a few questions this week about the different types of masks in different settings that Ambulance Victoria are using. I think they've been able to resolve those issues, and there's now an option to use whatever mask that the paramedic believes is most appropriate. In terms of that particular example, I haven't had that raised with me, but I'm more than happy to follow that up for you.
Are there resources there to fund that?
Well, we have an enormous stockpile of these things, and again, I think the best thing to do is to have the clinical staff and clinical experts making judgments about which PPE is best in which setting. That's not my area of training, so I am more than happy to follow it up. I know that's a very significant issue. Our health team are putting themselves in harm's way every shift, and we should be grateful to them, and we should all follow the rules by way of saying thank you to them. That's what the vast majority of Victorians are doing. There are some that aren't. That's very, very disappointing, that by making selfish choices you may well in fact be putting our healthcare heroes in harm's way. That doesn't make any sense, and that's why Victoria Police are not mucking about. The time for warnings is well over, and they will be issuing fines. There's just no excuse. No one could claim that they didn't know about having to wear a mask. No one could claim that travelling from one side of Melbourne to the other to get something you can get just metres from your home. Yeah, seriously, I think people deep down know and understand these rules. We've all just got to make better choices. We are here to do our job, and it's a team that's thousands big. We're all working hard, we're all doing the things that need to be done, but there's a job for all Victorians to do as well, a role for all Victorians to play. And in the first instance, if you're sick, you've got to get tested. If you are sick, you can't go to work. If you're waiting for a test result, the only place to wait for that result is at home. And then beyond that, if you are told you're positive, you've got to isolate at home. You can't be moving around the community. You can't be going to work, for instance. All that does is spread the virus. As for those well publicised, some of those other people who are just trying to make a political point or trying to make some other point from something they've read on an obscure website, I'm not too interested in giving them too much airtime. What I would say is that this is not about human rights, this is about human life, and all of us need to play our part in making sure that we don't have more and more families planning funerals, that we don't continue to see those mystery cases growing and the total number of cases growing.
Sorry, just one more question.
Sure.
Can you comment on claims that some businesses and the transport industry have been told to prepare to shut down from Monday the 3rd?
No, I couldn't comment on that. We have all sorts of different discussions with peak bodies, with people from across the all sorts of different settings. The most important thing, we've been engaged with those industries. Well, I'll put it to you this way: we've been engaged with those industries, freight, logistics, transport, for months now, and there is right now there is a process, a national cabinet process, to develop a code of practice in relation to freight movements, and trying to do everything we can so that we don't have people in the freight industry not just moving their cargo, but moving the virus around the country as well. So there's lots of different discussions, but I wouldn't characterise it in those terms. There's a lot of work going on. We've got numbers that are too high. We've got every reason to believe that these current settings will not get this job done, that we will need to do more. And when I've made those decisions, and when I'm able, off the best evidence and the best advice, and when I'm able to take people through that, I will. We've never hesitated to be clear with people, to be frank, to be as direct as possible. That's the way that I operate, and I won't be changing. That's exactly how it has to be. Today's not that day, but we work with everybody because that's exactly what we have to do, because this virus affects everybody. This virus doesn't discriminate one industry to the next, one postcode to the next. It doesn't discriminate at all. It's one of the great challenges of it.
Can I just ask you one question about those postcodes?
Yeah, sure.
There were, obviously a number went into harder lockdown before the rest of Melbourne did.
Yes.
Some of those postcodes have still got very high numbers. What
Yes.
is that saying about the lockdown? Is that concerning? And is there any recent data that is showing that they're actually doing a bit better?
I think I might refer you to the Chief Health Officer's release, and if we can get you some further analysis of that. What the question you're asking is exactly the work that's being done now. It has been being done all the way through, but it's gone to another level. There's many experts looking at that as we speak. They were last night. There's a number of very lengthy meetings last night about all of those sorts of issues. Ultimately, if we get to the point where we don't believe these rules, these settings, will drive numbers down, then we will need to go further. That is not a criticism of Victorians. It's not a criticism of the settings. What the settings have done, this is a stubborn thing. There's no doubt about that. This is a very stubborn thing. It is a wicked enemy, and defeating it, you need a number of different things. You need to make sure that you have got compliance at a very high level, that people are doing the right thing, and when you get volume is a real challenge. But some of the questions, some of that detail is exactly the sort of analysis that's going on right now. And if I can get you any more information, I will.
Will that analysis be public? And when precisely will Victorians get a little bit more certainty about what comes next?
We'll make announcements as soon as we possibly can.
And will that information that the panel's looking at, will you make that public?
I don't see why we wouldn't be able to give you the fullest picture about why we're doing what we're doing. But getting to that point is not for today. I know that's perhaps a little bit challenging. People might be frustrated by that, but at the end of the day, you've got to get these things right. The work is being done. I'm being frank and upfront. I'm not going to sit here and say that we're not doing that work. We are. When we're ready to make announcements about what this next phase looks like and what we think we need to do, then I'll be before you, and I will be doing that.
What's your message to employers who are imposing restrictions on which staff members can access sick leave? There's been talk that some employers are only allowing staff to take sick leave when they've tested positive, and not for the period when they're awaiting test results.
Well, I would encourage all employers to allow their staff to be properly compensated for protecting public health. That is the right thing to do. There is a $300 payment. My update yesterday had 4,200 of those $300 payments had been made. That number will have grown again because there was a lot of processing yesterday. If I can give you an update on that tomorrow or Monday, I will. but I'd ask all employers to understand that granting sick pay for a day or two while people are waiting for test results is a lot better than that person coming to work and potentially shutting your enterprise down. The cost, the relative cost of those two things, one is quite small and one is much, much bigger. So that'd be my message. Again, I wouldn't, if you gave me a specific, perhaps offline, I might be able to give you a more detailed answer. I don't want that to be read as a criticism of all employers, though. The overwhelming majority of businesses know that we'll get no economic recovery until we deal with the health challenge, and that's the order, that's the sequence that we have to work in. And the overwhelming majority of employers are doing the right thing and working closely with us, and we're very, very grateful for that. But sick leave is there for a reason, and you don't. If you're an employer, you don't want people in your business who've got symptoms and got tested and may well have it. That is not conducive to your business's good name, your business's profits, and staying open. Any other issues, guys? If not, we'll see you tomorrow.